There are some new guidelines out about prostate cancer screenings for men, and Dr. Jamie Messer is an associate professor in the Department of Urology at UofL, and he's here to talk about these new guidelines, which seem, quite frankly, a little confusing, Dr. Messer. So, welcome to the show, first off.
Oh, no problem. Happy to be here.
All right, prostate cancer screenings. I thought, all along, everybody, guys my age, it was you get a PSA test and they can tell whether you got cancer or not, and you go and get treatment. But now it's what? What's the medical association?
This kind of started really in 2011 and 12 with a change from the U.S. Preventive Service Task Force and their recommendations for PSA screening, basically making a recommendation against that. More recently, in April of this year, that federally funded task force has changed their statement on PSA screening and kind of come back around to recommend screening for men between the age of 55 to 69.
Okay, that's me. So I should get screened, shouldn't I?
Well, the screening involves not only the PSA test, but typically a rectal exam. And one of the task force concerns with PSA screening was there's no real true abnormal PSA or normal PSA. 11% of men with prostate cancer may have a normal PSA within the normal range of the laboratory test, and some men may have an abnormal PSA and not have a significant prostate cancer, and that's where the concern for the screening came in, and that's why it's important that it involves not only just a PSA blood test, but a digital rectal examination, an examination of a patient's family history for prostate cancer, which can increase your risk, and several other factors that go into whether or not that PSA may indicate a prostate cancer diagnosis.
So right now, the recommendation from the medical association is what? To go ahead and have that PSA
right
test
now,
as of April.
As of April of 2017, for all men, the recommendation is with what they call a grade C recommendation, which is that the evidence seems to favor screening, is that men between the ages of 55 and 69 get at least every other year PSA blood work and digital rectal examination for screening for prostate cancer, with a recommendation that potentially start as early as age 45 for men with a strong family history, either in a brother or father that was diagnosed with prostate cancer before the age of 65.
But if the prostate cancer screening, which is a blood test, shows up in 1 in 9 of those, shows a normal blood test, but they have cancer. I mean, you're kind of looking if you get the blood test results back. So what do you do with them if you're the doctor and the patient?
That's the concern that the Preventive Service Task Force had several years ago that led to their grade D recommendation, and that's why it involves not only just the blood work, but a rectal examination to determine is there something that's palpable of the prostate that's of concern. And what a person's risk factors are for prostate cancer, family history being one of the more important ones, and figuring out, is that normal PSA one of those areas of concern, and does a man have symptoms related to prostate cancer? Most men with urinary symptoms tend to have benign prostatic enlargement, but there's a percentage of those men who are going to have prostate cancer, and that's why I think it's unfortunate it's not as simple as just a blood test for screening. It requires several factors that go into determining a man's risk of having prostate cancer.
Again, we're talking to Dr. Jamie Messer. He's a urologist at the University of Louisville and also an associate professor in the Department of Urology in the School of Medicine. And we're talking about prostate cancer screenings and how you know what to do, basically, if you're a man my age. So I guess the other question is, I'm at home. How do I test myself, or can I even check, or will I feel anything if I might have prostate cancer?
In the PSA era, since the mid-1980s, most men don't have symptoms from prostate cancer. The most common reason a man's diagnosed with prostate cancer is due to PSA screening. Men with symptoms from prostate cancer may notice difficulty with urination, more frequent urination, having to get up at nighttime to go to urinate, a feeling that when
I thought every guy over 50 had to do that. Come on, man.
Well, that's the unfortunate truth to it. Most men have benign prostatic enlargement, and it's much less common that that's a symptom of prostate cancer. But if you have those symptoms, I think it's best to be screened either by your family physician or by a urologist.
All right, Dr. Stumbo, I'm coming over to see you here in the next couple of weeks. I need to check. All right, let's talk about something else that a lot of guys are worried about. I think is testicular cancer. You're a urologist. Yeah. How do I know, or what are the symptoms of testicular cancer?
Testicular cancer is one of the rarities, especially for men, because it's typically a cancer of the young. Testicular cancer predominantly affects young males between the age of 15 to 35.
Wow.
Is the highest incidence. The most common symptom of a man with testicular cancer is a palpable lump on the testicle. And although there are no hard and fast recommendations, most urologic cancer associations recommend a male do monthly testicular self-examinations, much how we recommend women do monthly self-breast examinations, and that if you feel something abnormal on one of the testicles, that it's probably best to get that checked out by a urologist.
I think the thing that you just surprised me with was that this is a young man's disease.
This very much is a young man's disease. The good news, and Lance Armstrong, with all of his unfortunate more recent events, is a testament to how effective cancer treatment can be for testicular cancer. The earlier it's found, the even better the prognosis is. But it's very much a disease that strikes men, if you will, in the prime of their life.
Wow. You're, how old are you? I'm going to put you on the spot. How old
41.
Are you? All right. So since the time you got out of medical school, when you were, 26, 27, whatever it was, from that time to now, what have been the advances in urology and the ability to track down some of these diseases in men quicker and better?
I think one of the most important advances for us with relation to prostate cancer are really two things. The advancements in multiparametric MRI technology, which have allowed us to more accurately assess a man with prostate cancer. We know that there's a percentage of men with prostate cancer that is insignificant disease, which is the other controversy in prostate cancer, that they're probably going to live for several decades with and never have troubles out of. The multiparametric MRI allows identification of more concerning prostate cancers and greatly improves the accuracy of our diagnosis. I think the other important advancement, and there's several trademark patented genetic assays, but the progression of genomics in cancer screening, allowing us to test for certain genetic markers in cancers that can be a marker for more aggressive disease and indicate somebody that may need more aggressive treatment than the standard treatment that we offer.
So catching it quicker, basically.
Yes.
Okay, so that's a good thing. One thing you did mention that I thought was interesting is you can live with prostate cancer for the rest of your life.
Yeah, that's when we initially see someone with a diagnosis of prostate cancer, I think that's one of the more surprising things for many men when we talk to them about prostate cancer. There's a percentage of men, and it may even be the majority of men diagnosed with prostate cancer, that have a prostate cancer that's indolent enough, meaning it's slow growing enough, they're probably going to live the remainder of their natural life with and never need active treatment. The advances in genetics, MRI, PSA velocities, and things like that allow us to, with greater accuracy, predict who those patients are going to be. But that's one of the keys. If you're diagnosed with prostate cancer, it may not always require immediate treatment. And when somebody has that, we put them on what we refer to as an active surveillance protocol, which is close monitoring of the PSA as well as prostate biopsies and MRIs to make sure that a cancer we think is slow growing is not becoming a more aggressive cancer.
All right, so final words real quickly to guys out there. What would you tell them?
I think to our young men, especially the college-age listeners that predominantly think they're immortal like we all did when you're in your teens.
I was like that.
Do a testicular self-exam once a month. And to those of us that are getting older, it's not the most comfortable exam, but go to your physician, get your PSA, your rectal exam, and if you get a diagnosis of prostate cancer, there's a lot of options out there, including may not even needing treatment.
Very good. All right. Dr. Jamie Messer, U of L urologist. Appreciate it.